1,000. That's how many deaths a local doctor claims Idaho lawmakers are responsible for. Good evening, everyone.
And we're talking about Medicaid expansion. That's been a controversial topic ever since the United States Supreme Court ruled that a state could independently decide whether or not it wanted to expand Medicaid.
Now, this is the third year the Gem State has opted not to help. Local News 8's Chelsea Brensel spoke with the local doctor today. And Chelsea, he told you that every day someone in the state of Idaho dies, but if legislators decided to expand Medicaid, those deaths could be prevented?
Jay and Carol, that is right. Dr. Kenneth Krell tells me what happens is people who cannot get insurance end up going to the hospital when it's too late. He says many of the deaths are related to chronic diseases that need regular treatment, but people aren't able to pay for those medical expenses. Now, I want to put something into perspective for you. 78,000 Idahoans fall into the Medicaid gap. Just think about it. That number is more than the amount of people who live in Idaho Falls.
I haven't been able to see a doctor for quite some time.
Tara Still is 1 in 78,000. She can't afford health insurance and doesn't qualify for Medicaid.
So I'm at a catch-22.
Combined, the 36-year-old and her husband work more hours than 2 full-time employees. But together, they bring home less than $30,000 a year.
I work as much as I possibly can.
Which is not easy for a woman with many health issues.
Being able to stand on my feet for a job that requires standing all the time is very difficult.
Tara was born with a bilateral club foot,
which is something I'll always have the rest of my life and needs attention.
Doctors say she needs to have another foot surgery that she can't afford. But that is not the only problem.
When I was pregnant with my youngest child, I had stage 4 cervical cancer, and I'm supposed to get that checked out every 6 months, and that hasn't been happening.
Without getting regular checkups, Tara could die. She fears she may become another statistic.
Cancer's scary. It's one of the leading causes of death out there, and I want to be around for my kids, and I want to get the health care that I need.
It's people like Tara that Dr. Kenneth Krell is fighting for.
About 1 life per day lost in the state of Idaho.
Krell says lawmakers are partially responsible for those deaths because they won't move forward with Medicaid expansion, even though 61% of Idahoans support it.
When I see individuals with late-stage disease that could have been treated at an earlier phase but weren't able to because they don't have access to health care, it leaves me very angry and frustrated.
Krell says those who have the power to change this don't fully understand because all of them have access to health care, and it's not fair.
As citizens in the state of Idaho, that's not how we treat each other. That's not how we take care of each other. And that's what the legislature needs to understand. This is not what Idahoans want, and this is not how we treat each other humanely.
Yesterday, Krell gave lengthy testimony at the State House in Boise. He says something must be done or more Idahoans will walk into hospitals and never walk back out. Live in the studio, I'm Chelsea Brensel.
Thank you, Chelsea. Now, lawmakers on the Democratic side of the aisle are not happy. Yesterday's bill hearing became informational only. The Democrats want the bill to expand Medicaid to come up for a vote. In a press release today, they said, quote, "It is an abdication of legislative responsibility to avoid making tough decisions, defer casting votes, and to fail to answer the constituents. Swift, considerate, courageous leadership on the part of the legislators should be expected and required. What is the function and purpose of being a legislator, if not to vote and be accountable to the needs of the electorate?"
Well, we got a little bit of